Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Hey everybody, good afternoon. Dr. Michael here. I'm coming live to you for What's Next Wednesday. Welcome one and all who are going to show up today. I'm just going to give a quick shout out to Doc Joseph Saxman, who just joined our channel membership at the AMA level. Thank you so much for joining, Joseph, and for supporting the channel. It means a lot. It means a lot. I really appreciate you. Yeah, so if you have, forgot what I was going to say. I lost train of thought. I was so happy about that. So if you have comments and questions while we're live, please drop them in the live stream chat or in the live comments on YouTube, on Facebook rather, because I'm live on Facebook and on YouTube at the moment. And this video, if you're new to this stream, is What's Next Wednesday, where we talk about upcoming content on the YouTube and podcast, and also give updates as well. And got some of both today. So everybody who's here live, say hello. Drop your salutations in the comments. Let me know you're here. I'd love to highlight you live and give you some name endorphins, like I did with Joseph. So what are we talking about today? You may have seen the topic of today's stream, which is how is Parkinson's diagnosed. So based on the poll that we put out, that is the most popular topic that people want to hear about, based on who answered the poll. And actually it was second only to what was the other topic that was really popular? I think it was the one about, I'll tell you what, I'm losing brain cells, everybody. It was about photobiomodulation, so red light therapy, things like that. That's actually a really interesting topic in itself. So that will be covered at some point in the near future. But first, the most popular one was this option, which was the how is Parkinson's diagnosed. And honestly, if you've had Parkinson's for a while, or if you are watching this thinking maybe you have Parkinson's, maybe you're interested in learning more about it, most of you know already, if you've had Parkinson's for a while or you just got recently diagnosed, there are some, or maybe you didn't know, there are some diagnostic tests out there. And that's what I want to talk about specifically in this upcoming content. But for those of you who are not familiar with that, most of the time, people with Parkinson's are diagnosed via almost exclusively through or entirely through clinical diagnostic criteria, which basically means when the physician thinks you have Parkinson's, that's what they label you with. I'm exaggerating a little bit, but that's essentially what it is. A neurologist observes gait pattern. They might have you do some coordination tests. They'll talk to you about history. They will. They might do measure your score on the Universal Parkinson's Disease Rating Scale. Things like that. Most of that's just by observation, clinical observation of the physician. And then further, for diagnostic criteria, a lot of physicians will use levodopa or carbidopa-levodopa as a diagnostic tool, because response to that medication actually does indicate most cases that it's most likely Parkinson's you have. If you have a positive response to the drug with symptoms, typically that means it's Parkinson's. And while that's not exactly a bad way to diagnose Parkinson's, it's probably not the most efficient way. There's also other conditions that need to be ruled out. And if you followed the channel for even any length of time, the last couple of months, You'll know we've talked about this in previous content just in the last month or two about comparing Parkinson's to atypical Parkinsonism. It really makes a difference in your treatment. If it's truly Parkinson's, it will respond differently to medications and management than other conditions might. Some conditions may not respond to levodopa, so it's really pointless to take it, right? So in the video that we're going, in podcast episode, we're going to dive deeper into what diagnostic tests are available for Parkinson's today, and in terms of accuracy and things like that. So that's what we're going to talk about. And I did want to also give a quick announcement, a couple announcements briefly. This coming Friday, so 2 days from now, there's a webinar that I'm hosting. It's a free webinar called 5 Top Parkinson's Myths and How to Debunk Them. We've now completed 2 of the 3 dates and times for that webinar. This is the last one I'm going to do for January, which is coming up Friday. So you've got, if you'd like to register for that, technically I'll leave it open to register to that up until the last minute if you'd like. But that's going to come up Friday at 12:30 p.m. I gotta check my calendar and make sure I should be blocked at that time. I think it's either 12 or 12:30 now. I'm already forgetting what time it is. Anyway, it's at noon, around the noon hour, and the other 2 have been in the morning. So that's a free webinar, and we've had several people attend each one and have liked it. And I'll talk about this in the webinar, but I want to talk about it right now on this live stream, and there's information in the description on YouTube and in the post on Facebook on this information I'm about to share with you, because time is ticking, and that's why I don't want to wait until the next webinar. I have a new course that I launched. It's called Parkinson's Roadmap: Journey from Confusion to Confidence. And it's a course that has been beta tested over the last year by about 20 individuals, and they have left good feedback on the class and feel like it would be worth sharing with other people. And it's going to be formatted a little differently than it has been over the past year, but it's going to be great, and it's going to be a course that will really be able to dive deeply into specific topics surrounding Parkinson's in a bite-sized chunks, understandable information that you can digest easily. Similarly to my teaching style in the content I put out, but it will be a class dedicated to that, and there will be live Q&As weekly. I want to ask you, and actually I want to acknowledge Shamim's comment before I continue. Shamim says, I'd love to have meds that help with pain in Parkinson's so I can live a normal life without pain and can stand at least on my legs without fear of falling. Yeah. I'm sorry that you're going through that. It's tough. And pain is something that is associated with Parkinson's. And medications can help some, obviously, but it's not everything. So I wish I could tell you that there was a quick solution to that. Medications, exercise, diet changes, that lifestyle change that needs to come with Parkinson's to help manage things, that's important to consider here. That may not eliminate pain, but it could reduce pain. And I can't go into that now. There's all kind of different types of pain that can be associated with Parkinson's. And so I know Shamim well enough, at least online, to know he's working on this, but it's a day-to-day journey, and every day is different. Some days are going to be really hard, and some days will be a little better. And medications don't always work well every day. And there's a lot of reasons that can happen as well. But I support you in that fight, Shamim. Anyway, as far as the class, I wanted to poll the audience real quick. Matter of fact, give me just one moment. I'm going to do that here on the. Let me just for the. I'll just poll you without putting it on a real poll on the channel, but just verbally. I was going to ask you all, when you first got diagnosed with Parkinson's, I'm assuming that those of you watching are diagnosed already. How many of you, when you first got diagnosed, felt like you were empowered with all the information and confidence that you needed to basically face the diagnosis that you just got thrown in your face? I mean, let's face it, it's kind of a slap in the face to receive a diagnosis like Parkinson's or any other chronic disease. And I want to know if you felt when you were diagnosed that if you felt that your healthcare team had your back, if you felt like you basically had that feeling of, yeah, you know what, it's okay. Even though I've got Parkinson's, I can know what to do because I have got all the information available. Just say yes if that's how you felt. Nobody yet, right? Well, you would be rare if you said yes, because the experience I've had over the last, particularly over the last 6 years, but over my entire career of almost 11 years, 12 years actually, 13, I don't know. It's been over 10 years. 2012, I can't do math, 13 years, almost 13 years, is that something will come up like a non-motor symptom, or something will come up like stress effect on Parkinson's symptoms, something kind of random and minor like that. And I'll mention something, and the person will say, that's the first time anybody's ever put the two together, that could be related to my Parkinson's. It shouldn't be me saying it for the first time. I think the information I'm sharing should be really forefront information, something you receive whenever you get diagnosed, because, or at least that there's a resource you can be pointed to, even if your doctor doesn't have time for that, that they point you toward a resource for that. So that's just an example of being empowered with the knowledge that you can fight against this thing, right? I had a doctor once that one of my own patients, as a therapist, who, when she was first diagnosed, he said, exercise isn't going to make any difference for you. And she thought that didn't feel good, you know? Like, she was like, that just doesn't feel right. That doesn't feel right, that I don't really believe what you're saying to me, so I'm going to ask for another opinion. So she drove from where I live. She drove over 2 hours from here. Maybe, I forget how far Springfield is from here. But anyway, in Missouri, it's at least 2 hours drive to another movement disorder clinic. They specialize in Parkinson's, and they refer all their patients for LSVT big therapy because they really believe in that. That's what I do. And they said, no, you need to get LSVT big right away. She was just diagnosed that year. So, and they referred her back to me, who was in the town she came from in the first place, which is just ridiculous. But anyway, it just goes to show you, in the medical world, there's just not a lot. Everybody tends to be siloed and like, oh, I've got my own thing and I don't talk to anybody else and I don't refer to other people and I don't believe in this. And they're not putting the patient first. The person in front of them and what they need is what's important, not some opinion, right? So anyway, I'm getting on a soapbox, but my whole point in this is that I've created a product that is not perfect and is not everything, but it would give a really great overview of Parkinson's in just a few short weeks, over 12 lessons. And that's what this course, the roadmap course, is. And so there's a link in the description if you're interested in that. And the first 10 people that sign up for it are going to get 75% off. So that goes away after 10 people sign up. And the cart closes on Friday at midnight. Well, I guess midnight on Saturday. So don't miss out. And I'm going to acknowledge Shamim's other comments here really quick. Shamim said, thanks. I'm not sure what that medication is. There's trazodone, but that might be more for sleeping. anxiety. Pain meds makes you sleepy most of the time. Yeah, and they can, depending on what kind of medications they are. And a lot of times the pain meds tend to be kind of, they have that kind of effect of creating drowsiness or grogginess. Also, that makes it unsafe to operate machinery or drive cars, whatever. So, which that could be a problem down the road with Parkinson's anyway. But so Shamim felt that way. Many family members, they deny having no pain and manage for. Wait, they have no pain and manage their livelihood very well. So, in other words, I think what I'm reading you say there, Shamim, is that other people aren't recognizing your suffering. Yeah, I guess that makes sense. I mean, my question, I think I'm reading your question, your response correctly, in that you felt like you didn't have the knowledge or support you needed to begin with. There are a lot of brilliant physicians, Dr. Michael Oken, Bastian Blom, all those people. They understand Parkinson's very, very well, and they've written wonderful books on the subject. But have any of them individually sat down and taught you about Parkinson's? Most of the time, a webinar that they will give will last 50 minutes to an hour. Not that that's particularly the time limit is a problem, but they don't ever cover one topic for 30 minutes. It's usually, well, they might. Sometimes on YouTube, there's like an entire video that's like an hour long about one topic. It's just ridiculous. You don't have to spend an hour talking about cognitive changes in Parkinson's. You can talk about that in 10 minutes. So that's my point is the way that I approach things and the way that it would be done in this class, it will be done in this class is, and the people that have been through this class last year could tell you, is one topic will be about 30 minutes of talking, period. Because there is a lot to unpack on those topics, but it's 30 minutes. It's not an hour. And then we will get together the way this is going to be formatted is we'll get together in an hour long, not hour long, but however long it needs to be, basically a question and answer that will be interactive and live so that we can talk to each other, introduce ourselves to each other, get to know each other better. And you can ask those burning questions. So that is the bottom line. The class is meant to be a starter or beginner course for someone with Parkinson's, even if they've been diagnosed for several years or many years. You can still learn something. And I firmly believe that, because people that have been in the class that I've been teaching over the last year who have had Parkinson's for a long time all say that they've learned something new at some point. So that's my brief invitation and a shameless plug for the new class, and the links in the description or the posts on Facebook if you're interested in looking. And for those of you who want the first 10 discount, Roadmap 10, I'll put that up here real quick. Using this promo code, that will be the 75% off for the first 10 signups. So that's all I've got. I look forward to seeing you in the premiere of the next episode of the podcast on YouTube, and that's going to be this coming Saturday on diagnosis of Parkinson's disease, or how is Parkinson's diagnosed. And I look forward to seeing you all there at the premiere, whoever is able to show up. And again, thank you so much, Joseph, for joining the membership on the channel and for your support. It means the world to me. And I look forward to seeing all of you next time we do a live stream. Hope you have a great day. As always, be empowered.